So we get a lot of patients asking us about sedation dentistry, and just wanted to kind of explain options for patients who are very worried, concerned, anxious, fearful of the dentist. And there's a lot of patients who have experienced that. Maybe they've had really bad experiences growing up, or they're just busy, or just whatever it is where they just need to come in, relax, get the work done, not have to think about it. And so there's a variety of options. The variety of options include the first line of sedation, I would say, is laughing gas or nitrous oxide. And nitrous oxide is a great way just to kind of take the edge off, kind of give someone the sensation of kind of a floaty sensation, and kind of makes the time go faster for the patient, where if it's just, they're here for an hour or two, kind of like a minimal, moderate procedure, nitrous oxide could be a great option. The patient's able to drive to and from the appointment, which is great. So a lot of our busy working patients prefer the nitrous just to kind of help them kind of take the edge off to get through the procedures if they're having, a moderate procedure done. Another option for sedation is oral sedation, and I'm both certified in nitrous oxide sedation and oral sedation. And oral sedation could be something like a Valium that a patient takes before the appointment, and just kind of relaxes them, puts them in just a much calmer state. Or it could be something called Halcyon, which has kind of like an amnesia effect, where the patient tends to forget about the appointment and the time that they're here. So if it's a very extensive procedure or a long procedure, Halcyon is often used. And again, it has that amnesia effect, so patients tend to kind of forget the appointment. If oral sedation is going to be used, we usually recommend, or we always recommend, having a ride to and from the appointment, depending on the type of oral sedation we use. And then the patient just kind of taking it easy for the rest of the day. And then the final piece of sedation is where we actually work with a board certified anesthesiologist who's mobile, who actually comes to either of our locations in downtown or Lakeway, sets up, and basically is able to put the patient under using IV sedation. So for a lot of our big implant cases or big cosmetic full mouth type cases, we're utilizing the help of our anesthesiologist to provide IV sedation to make the patient's experience way more comfortable, where they can just literally sleep through the procedure. So I know there's a lot of patients, again, who ask about sedation dentistry because they're fearful, anxious, or just know they need to get a lot of work done. And with sedation dentistry, often we're able to get a whole lot of dentistry done in a short amount of time, and actually do years worth of dentistry in just a few visits. So I hope that helps and answer the question about sedation dentistry.